So good afternoon all. Today I'm going to present before you my paper, that is Unilateral Proptosis, the Untold Mystery of the Pandora Box, the Orbit, Etiology and Management. So to start with, proptosis refers to forward protrusion of the globe with respect to the orbit. The causes of unilateral proptosis are innumerable. The importance lies in early diagnosis, timely intervention, and prevention of complication, as it can cause potentially blinding and even life-threatening events. So my aims and objective of this study was to study ophthalmology cases presenting with unilateral proptosis and to analyze the clinical profile of such cases. Coming over to the materials and methods, the present clinical study of unilateral proptosis was conducted in my college, that was Assam Medical College, Dibrugarh, for a period of 1 year. Inclusion criteria consists of cases presenting with unilateral proptosis, and exclusion criteria was all cases presenting with pseudoproptosis and cases presenting with ocular trauma like penetrating injuries and perforating injuries. The proper selection of the cases for exophthalmometry was done and Lutz exophthalmometer was used. A detailed history related to the disease condition was taken. Visual acuity and a detailed local ophthalmological examination was done, and etiopathological diagnosis was done on the basis of local clinical examination, laboratory test, and relevant radiological examinations. According to the etiopathological diagnosis, a management strategy was individualized for each case. Now, coming over to the results, a total of 40 cases of unilateral proptosis was taken. Coming over to the age distribution, the patients were between 1 year to 73 years of age, and most of the cases were between 31 to 45 years. Male was outnumbered the female patients. In clinical presentation, there was clinical features varied from watering, redness, discharge to ocular pain, loss of vision, loss of weight, fever, diplopia, and even void reflex. It was seen that the right eye was more affected than the left eye, and the type of proptosis was axial in more nature than eccentric. The amount of proptosis varied from 2 mm to 15 mm. And the visual acuity varied in various patients, especially it was seen in between 6/9 to 6/18. In the ophthalmoscopic findings, we could, basically all was normal, but we could also find optic nerve head edema, facial toxicity, and choroidal folds also. ENT findings, we could see sinusitis more in cases. In the radiological findings in relation to the orbit, we could see that there was normal in most of the cases, but there was also presence of soft tissue mass in some cases and fractures. In the ultrasonographic examination, we saw that there was more of mass lesions followed by inflammatory lesions. In the CT scan finding, we could see that there were more of intraconal space occupying lesion followed by extraconal, followed by inflammatory, and followed by other findings. In the histopathological reports, we could see various features like rhabdomyosarcoma, pseudotumor, small cell carcinoma, retinoblastoma, malignant melanoma, cavernous hemangioma, and also small squamous cell carcinoma. So coming over to the etiological distribution, we could see that there was more of the neoplastic group, then inflammatory group, then endocrine, followed by vascular. So these are the photographs. According to the etiopathogenesis, the various treatment modalities that were chosen was conservative surgical, chemo, or radiotherapy. So these are the visual restoration chart. And coming over to the discussion, we all know that proptosis present the ophthalmology with a serious problem because of the diversity of the etiological factors it present with. Age of the patient is a cardinal factor in the initial assessment of a possible cause. In the present study, maximum number of patients with proptosis were found in the second decade, which was consistent with the study that was done by Dr. Shiva et al. Also, in some of the case papers, that is by Babita Sharma et al. And Susan D'Souza et al., in which we could see that there was more of the axial proptosis, that was also consistent in my study. Clinical findings was also consistent in the study of Masoor et al. And Shawarma et al. Paper. Also, the etiological distribution of the cases present in the present study correlated with the reported incidence of the study of Babita Sharma et al., in which the most common cause of proptosis was neoplasm, which was similar to my study. In contrast to this, Kavita P. Vasu et al. Showed that the most common cause of proptosis was inflammation. So to conclude, unilateral proptosis is a multidisciplinary problem and requires collaboration of other specialties. Considering the diverse etiology of the diseases causing proptosis, definitive management varies accordingly. CT scan was useful to demonstrate the precise extension of the orbital lesion and the involvement of paranasal sinuses and nasal cavity. Thank you.
Thank you, Doctor. Can you please stop the sharing?
Yes.
Yeah. Thank you, Dr. Sunanda. That was a comprehensive documentation. I would just like to emphasize that yes, in a proptosis case, we must be looking beyond the eye and the orbit, because the lesion can come from any of the surrounding the sinuses. So very important, the radiological is very important. And also the acute and chronicity is also important. Acute proptosis doesn't always mean an inflammatory. Even granulocytic sarcomas or rhabdomyosarcomas can present in an acute. So important to highlight, because the acute one presumes is inflammatory or an infection, but it could also be a malignancy or a neoplastic growth.